Hello, and welcome to the webinar series on preventing healthcare-associated viral hepatitis infections. This series is designed to provide a review of Centers for Disease Control and Prevention recommendations for injection safety and safe-assisted diabetes care. The series consists of 5 modules that cover various infection prevention topics. Some modules contain information for healthcare workers providing direct patient care, while others contain information for healthcare facility administrators who design and oversee the implementation of infection control policies and standards. This series is supported by a cooperative agreement from the Centers for Disease Control and Prevention for viral hepatitis surveillance and prevention. To give some background on the basis for this webinar series, this module includes some basic information regarding hepatitis B and C outbreak investigations and injection practices within Michigan-based healthcare facilities. Failure to maintain strict adherence to safe injection practices during patient care can result in serious consequences such as transmission of blood-borne viruses, including hepatitis C virus, to patients. Between 2008 and 2014, CDC documented 44 known viral hepatitis outbreaks associated with healthcare in the United States. In total, these outbreaks resulted in the identification of 410 cases of hepatitis B or C which were tied to unsafe medical care. The majority of these outbreaks, 42 out of the 44, occurred in non-hospital settings. In addition to unsafe injection practices, drug diversion involving healthcare providers who obtain injectable controlled substances, such as opioids, for their own use, increases risks of healthcare-associated infection with hepatitis C and other viruses. CDC and state and local health departments have assisted in the investigation of 5 documented infection outbreaks stemming from drug diversion activities that involved healthcare providers who tampered with injectable drugs. These outbreaks revealed gaps in prevention, detection, or response to drug diversion in U.S. healthcare facilities. With nearly 8,000 new chronic hepatitis C cases annually reported in the state of Michigan, improper use of syringes, needles, and medication vials during routine healthcare procedures, such as administering injections, could easily lead to unfortunate events impacting both patients and healthcare providers, such as notification of patients of possible exposure to blood-borne pathogens and recommendation that they be tested for Hep C, hepatitis B, and HIV, or referral of providers to licensing boards for disciplinary action and malpractice suits filed by patients. In addition, hepatitis B and hepatitis C are most common in older adults who frequently access healthcare. HCV is most common in individuals born between 1945 and 1965. Hepatitis B, according to Wesley et al. In the Journal of Infectious Disease in 2010, showed that older adults are more likely to be infected with hepatitis B, and older adults are less likely to be vaccinated for hepatitis B. So there's a larger hepatitis B reservoir and susceptible population in the older age group. Because these older adults are more frequent consumers of health care, it increases the risk of blood-borne pathogens to be spread in these settings. Over the past few years, the Michigan Department of Health and Human Services Viral Hepatitis Unit has conducted various surveys related to safe injections and diabetes care. These surveys targeted ambulatory surgical centers, ASCs, and long-term care facilities, LTCFs, because these facilities perform a large number of injections, provide assisted diabetes management on a regular basis, and have been implicated in healthcare outbreaks associated with poor injection safety procedures. Findings from these surveys suggested that increased education efforts in regard to assisted diabetes care and medication vial use could be beneficial for the safety of Michigan patients. In May 2013, 2 surveys were conducted in order to gain a comprehensive understanding of both policies and practices regarding injection and assisted blood glucose monitoring safety within ASCs. The first survey, targeted at ASC administrators, focused on facility infection control policies and trainings. 124 ASCs were contacted by phone, and a total of 63 participated in the infection control policy procedure survey. The second survey was directed at healthcare workers and their knowledge regarding injection safety and use of blood glucose monitoring equipment. In total, 873 paper surveys were mailed to 42 facilities, and a link to a web-based version of the survey was emailed to 29 facilities. A total of 287 healthcare workers participated in the injection safety and blood glucose monitoring survey. Of the ASCs surveyed, all facilities had policies and procedures regarding medication vial use and labeling protocols. Fewer facilities, 89%, had diabetes equipment usage and cleaning protocols included in their infection prevention policies and procedures. Of the healthcare workers that completed the survey, all who prepare or administer injectable medications correctly identified the statement, "Syringes can be used to give an injection to more than one patient as long as the needle is replaced with a clean needle," as false. Also, the majority, 85%, of healthcare workers correctly identified the statement, "Medications for multi-dose vials for more than one patient should not be stored in immediate patient treatment areas," as true. Over 20% of healthcare workers incorrectly identified the statement, "Finger stick devices can be used on more than one patient as long as the lancet is changed and the device is properly disinfected between patients," as true. An additional 4.5% were not sure if finger stick devices can be used on more than one patient. These findings are alarming because finger stick devices are single-use items and should only be used for one person. The results of these surveys indicate that additional education on assisted diabetes care and subsequent policy development could benefit healthcare workers in Michigan ASC facilities to keep their patients safe. In December 2013, 447 long-term care facility administrators were contacted via email to participate in Phase 2 of our project. A comprehensive webinar was recorded entitled "Injection Safety: Preventing Viral Hepatitis Infections." Administrators were invited to view the recorded version of this webinar, and administrators were also encouraged to share the webinar with their healthcare workers who prepare or administer injectable medications, utilize diabetes management devices, or those who train staff on infection control and patient safety. Prior to beginning the webinar, participants were asked to complete a short pre-test. The evaluation included 6 true and false questions on injection safety topics and 3 demographic questions. After viewing the webinar, participants were given the opportunity to voluntarily complete a post-test in exchange for a certificate of completion. A total of 222 people completed the pre-test and 179 completed the post-test. The majority of participants correctly identified that syringes and needles are single-use items and should be used to give one injection. The proportion of persons who were not sure how to answer this question decreased from 1% to 0%, and the proportion identifying this statement as true increased from 98% to 99%. The majority of participants correctly identified the statement, "Medications from multi-dose vials should be stored in immediate patient treatment areas," as false. Correct responses increased from 74% in the pre-test to 84% in the post-test. This was associated with an 8.5% drop in the number of persons not sure how to answer the question in the pre-test. Overall, though, the percentage of correct responses was lower than in other survey questions. This suggests that storage and use of multi-dose vials is not as well understood by the healthcare workers. The majority of participants correctly identified the statement, "Finger stick devices can be used on more than one patient," as false. The number of incorrect responses decreased by 6%, while the number of correct responses rose by 7%, suggesting that this is an area where healthcare worker knowledge of CDC's recommended best practices is lacking. The majority of participants correctly identified that insulin pens should be used on only one patient. The number of survey participants who correctly identified this statement as true increased from 91% to nearly 100%, while the number of incorrect responses decreased by 5.5%. The results of these surveys indicate that additional education on multi-dose vials and assisted diabetes care could benefit healthcare workers in Michigan long-term care facilities to keep their patients safe. As was mentioned at the start of this module, this series includes 5 modules. 3 contain information appropriate for healthcare workers who provide direct patient care, and 2 contain information for healthcare facility administrators responsible for supervising the implementation of infection prevention policies and standards. The topic areas for this series are injection preparation and administration. This module provides a review of safe injection practices and includes information on hand hygiene, vial handling, and needle and syringe use. Number 2, assisted blood glucose monitoring and insulin administration. This module provides a review of safe assisted blood glucose monitoring and insulin administration practices and includes information on fingerstick device, blood glucose monitor, and insulin pen use. Number 3, protect yourself, protect your patient. This module provides a review of vaccination recommendations and cleaning, disinfection, and sterilization techniques. Number 4, sustaining results over time. This module includes tips for monitoring infection control policy implementation. And finally, addressing drug diversion. This module includes information on preventing and addressing healthcare personnel drug diversion. The content for these modules was developed using a variety of resources which have been included at the close of each module. The modules will be moderated by Joe Coyle, Viral Hepatitis Unit Manager, Emily George, the Viral Hepatitis Nurse Consultant, and Sharday Fisher, Viral Hepatitis Prevention Coordinator, will narrate the modules.